25 million unsafe abortions take place around the world every year. That's according to the World Health Organization, which notes that while many countries have improved access to safe care, still 40% of women of childbearing age live in a country with highly restrictive abortion laws or where abortion is in fact illegal. Well, we're joined now by a doctor who has pretty much dedicated her career to trying to change that, founding Women on Waves, which aims to empower women. She has sailed around the world providing information, medication and everything else concerning abortion. Dr. Rebecca Gomperts, welcome to the show. Tell me, first of all, we've looked briefly at the statistics, but can you tell us about some of the women that you've met that did not have access to safe abortions and what this meant for them?
Thank you so much for the invitation. An unwanted pregnancy can affect all of us. So the women that have reached out to us over the years, and so far we've helped over 100,000 women. They are from all backgrounds. It can be a young woman that wants to finish her education. It can be a mother of three who just cannot afford to have another child anymore. It can be somebody who is living in a domestic violence situation. And especially now during COVID, also the countries where abortion is supposed to be legal, women find really hardship to access abortion services.
So tell me a bit about how, first of all, Women on Waves works. I mean, this was a ship that you sailed to the countries with the most restrictive abortion laws where it was still forbidden, coming into international waters, but then women, I guess, from those countries made it onto those ships. Tell me a bit about how that all worked and if it's still taking place.
Yes. So Women on Waves was set up to sail a ship to countries where abortion is illegal. By sailing into the country, we could take women on board, sail to international waters where we could offer safe medical abortions, so abortions with pills. Then we sail back and the women could disembark again. These campaigns are also meant to call attention to the injustice that is done to women that are living in countries where abortion is illegal. But for example, our campaigns in Portugal, which was in 2004, a long time ago, it actually catalyzed the legalization of abortion there. So that is the aim of the campaigns of Women on Waves, to give help to women that need it, but at the same time to catalyze legal change.
And
at the moment, yeah.
No, go ahead. I was just wondering how it worked for the women how they were able to make it onto that boat and back. You know, how it was organised and how the countries reacted to that vessel.
So we intend to have the ship inside the country in the harbour, so that women can just go on board in the harbour and sail out. Well, this didn't always happen. In some countries, the military intervened. For example, in Portugal, the Minister of Defense said that we are such national security. This also happened in Guatemala, and the ship was expelled. But I think how we have to look at these things. So it's very interesting when a military dictatorship or regime suddenly makes access to a healthcare service for women their main priority. There's many other things going on. But the way the ship works is that it's really catalyzing support for abortion rights for women around the world. And of course, now during COVID, it's really difficult to organize campaigns. But fortunately, there is Women on Web, which is helping women with telemedical abortions all over the world, so that they have access to abortion pills.
Indeed. Tell me a bit more about that. I was just reading about it yesterday. It's Women on the Web. It's abortion pills so that women can really carry out their own abortions. I mean, how does that work? How safe is it? How skilled or where does one need to be for that to be safe?
So research over the last 20 years has shown it's extremely safe. An abortion with pills is as safe as an abortion in a clinic. It's safer than the use of Viagra, for example, or many over-the-counter painkillers. The World Health Organization this summer has released a statement that it supports self-managed abortions, so self-use abortions up till 12 weeks of pregnancies at home. It's very similar to having a miscarriage. 20% of the pregnancies are ending in a miscarriage, and that is what the medicines do. They invoke a miscarriage. So the safety is not at stake. And what we have seen with COVID is that countries like the United Kingdom, but also France, have allowed for telemedical abortions to take place to make sure that women continue to have access to abortion services despite the restrictions that were imposed by COVID. So the work that Women on Web has been doing for the past 15 years is now mainstream. It has been taken on by many regular healthcare services.
That sounds like a possible potential solution to really get safe abortions then to women no matter where they're based in the world. I imagine the next main stumbling block perhaps is the financial aspect of rolling that out.
Well, no, we do that already. Women on Web is helping women all over the world getting access to safe abortions. Saudi Arabia, Africa, Asia, wherever they live. And the finances is that women are asked for a donation, but if they cannot afford it, they will get it for free.
Okay, when we look at like 25 million unsafe abortions still around the world every year, according to the World Health Organization, sounds like such an enormous number. Yet when we see studies saying that the countries that have legalized safe abortions, the number of abortions carried out stays relatively the same as when they're illegal. Would you agree with that? Do you see any discrepancies?
No, absolutely. Making abortion illegal does not prevent any abortion from happening. What I want to say, though, is that the availability of abortion pills, because there's also underground markets in the countries, it has reduced the maternal mortality, so women dying from unsafe abortions, a lot. Since the last 10, 15 years, it's half of what that used to be. The problem is that that many women are very vulnerable, and it's sometimes really difficult to find the abortion pills for women in countries where it's illegal. So it should be part of a normal healthcare system. So that women can go to a doctor or a pharmacy and get the abortion pills instead of having to go to the black market or the internet.
You've had a lot of first-hand experience travelling around the world. I mean, have you any idea why these restrictions persist in so many countries?
Well, it has to do in general with the rule of law. Many of the countries where abortion is still illegal are countries where the general democratic process or the rule of law is actually very bad. Or you see in countries like, for example, in Poland, where there's a real problem at this moment with the democracy there, that the rights of women are being turned back. So what we see is in the countries where there's a good democratic process, and that is, for example, in Ireland, in Northern Ireland, but also in Argentina and in South Korea and in Thailand, where abortion was recently legalized, women's rights are respected. And it's the countries where there's really oppressive regimes, where women's rights are not being respected and abortion is still illegal.
Okay, Doctor Rebecca Gomperts, thanks so much for taking time out to talk to us here on France 24. Much appreciated. You're watching live from Paris. If you're just joining us, these are our top stories this hour. The trial of the police officer charged with the murder of George Floyd begins this Monday. Protesters have gathered in front of the courthouse in Minneapolis demanding justice. Selecting the jury in such a case could take weeks.